the Wnt5a is a interesting protein. These are proteins that are also critical during early development. And we identified some time ago that one particular Wnt factor called Wnt5a is actually binding to ROR1 and causing it to become activated. And early on, we found that that could activate this pathway, which I talked about earlier, NF-kappa B. And I think that the activation of cells with Wnt5a, you can do this in vitro. I've always wondered about this. If we take leukemic cells out of the patient, patients have leukemic cells, they're floating around, they're doing just fine. And I've always marveled, when we took the leukemic cells out and we put them in the laboratory, if we wash the cells and put them in really good culture media, they start dying. It's like studying a snowflake. And so we're trying to figure out, why do these leukemic cells die so quickly? So actually, some time ago, when Jan Berger, who's now at MD Anderson, was in the laboratory, we noted that these accessory cells that grew out of the blood actually could support the leukemic cells. And these we called nurse-like cells. We now know them to be like a lymphoma-associated macrophage. In other words, they're derived from monocytes. And you can put leukemic cells, these cells differentiate. It's like a folie à doigt, where these cells differentiate in the context of the leukemia. And you can see that chemokines actually cause these leukemic cells to cluster around these cells like bees to a honey hive. And they gain sustenance from that interaction. And that whole brought up the concept of microenvironment. Namely, these cells exist in the lymphoid tissues, and the leukemic cells are homing to those lymphoid tissues where they get survival hits. In other words, they become activated. And now these newer drugs like the BTK inhibitors, they actually short circuit that, so these cells can't get to these survival niches, which include other cell types, primarily also these nurse-like cells that we identified some 20 years ago in the laboratory. Well, I think another factor that I mentioned was Wnt5a, which you can find actually in the plasma of patients with CLL at very high levels compared to age-matched controls. It's very peculiar because it allows for almost the disease to be able to transcend its microenvironment. And we noted some time ago that if you put Wnt5a into your culture media, in the absence of these accessory cells, you can actually improve the survival of leukemic cells. So it does promote survival of CLL cells. And then we also identified that what was happening is it was the activation of ROR1, because if we can interfere with the interaction of Wnt5a with this ROR1 protein, that survival advantage was abrogated. So you lose it. And so that's one of the factors that we do now, is to look at leukemia cells from patients that are freshly isolated, and you can stimulate them with Wnt5a to keep that going versus deprive them of Wnt5a. And what you notice is that if you look at the difference before they start dying off, you can look at the loss of production of certain factors. And one factor is MMP9, or matrix metalloproteinase 9, which does play a very important role in the ability of the leukemic cells to go from A to B to traffic through the body. So I think this is something that there are other facets to ROR1 signaling that may help the cells get around this trafficking issue and also survival issue. And trying to block that, I think, could represent a good way of interfering without causing much toxicity, because, as I mentioned, ROR1 is not present at levels that we can really appreciate in the body. So it becomes very selective. And I must say, this trial with zilovertamab, which is the anti-ROR1 antibody, and the ibrutinib, there hasn't been any increase in toxicity. So it's very well tolerated. It's almost like getting an anti-leukemia or anti-tumor effect and eating it too without much in the way of toxicity.